Hi, my name is John Holden. I'm a physical therapist in Sonoma, California, and I'd like to talk about knee pain that doesn't get better in a normal amount of time. And I just want to share a couple stories to help people think outside of the box. Sometimes it's not coming where you think it's from. So, the first story involves a high school basketball player with chronic knee tendonitis, and it was to the point where they couldn't play basketball anymore. They've been seen in orthopedic and chiropractors and physical therapists for 2 years with no change, given a bunch of exercises, told to rest, stay off of it, all with no change. So I evaluated the student, who's a student athlete, and checked the knee, and she had a little bit of pain in the knee, but nothing significant, full range. And so I checked her musculature around the knee and looked at the quadriceps, and the affected knee was the right side, if I remember right, and there were no quadriceps contraction on that side actively. She couldn't engage the right quadriceps. And so I immediately thought, well, there's no derangement in the knee. It could be a pain response, but without the derangement, not likely. So let's check her back to see if the back is an influence on the musculature of the quadriceps. And her back was tight on that side. So I gave her an exercise that I give a lot of people, and it's a type of squat, and it helps open up the back. And so we did that. It took about 30 seconds. And then I checked and had her check her quadriceps reaction, and she had full quad reaction. So that was telling me it was a neurological component coming from a pinched nerve in her back that was affecting the quadriceps. So now she had full strength, and it took me 30 seconds to get there. And I'd asked her, did anybody else ever check your back in relation to your knee? And she said no. And I thought that was kind of sad, because it was obviously affecting it, and no one had been getting any results for 2 years, so why not look somewhere else? So within a minute we found out she had full quad contraction. Now the pain response came from jumping up and down, and so I had her jump up and down, and immediately the pain came, and it continued. So I'm like, all right, so we've got the muscle back, but we still have a pain problem. She's like, correct. I'm like, okay, so let's keep going. What if it's coming higher up the chain, maybe your neck? So I had her check her neck, and her neck was stiff on that side. Not significantly, not noticeably when you compared left to right, but if you're looking for it, you could see that it was a little bit less on that one side. So same thing, I gave her some exercises, tried to loosen up the neck for her, and then recheck. Well, I couldn't increase the range of motion of her neck range of motion with rotation, and those exercises weren't working. So I'm like, they usually work unless something's blocking it. So can you tell me what happened when you hurt your knee 2 years ago? She says, well, we were hiking, and a friend of mine, and we were competing, and they were beating me up the hill, and I got frustrated, and then my knee started to hurt. I'm like, well, do you remember the frustration? Do you remember feeling the frustration? And she said, yeah. I go, can you feel it right now? And she said, yes, I can. I go, where is it? She says, it's right here in my neck. And it's the exact same place where she was stuck. And so I'm like, okay, let that frustration be there. Keep remembering the time. Keep feeling the frustration. But now, once you let it be there, relax your jaw, your face, your forehead, the neck, your chest, and just see if that frustration wants to do anything, if it wants to go anywhere. Let it. But just be still with it, and keep relaxing around that area. And so she did, and as she remembered the time, that frustration started to move and go to her face and go to her chest, and then it started to get warm, and then within like 3 or 4 minutes, it was gone. And she's like, okay, the frustration's gone. I go, let's find out. Go back and remember it. She remembered the time. She couldn't feel the frustration anymore. I go, okay, it might be gone. Let's check the neck. And boom, she moved her neck, full rotation, full range of motion. It totally opened it up. I'm like, that's what I needed to see. Let's see if that affects your knee pain. So jump up and down. And then she started jumping up and down, pain-free. She was jumping up and down for a minute, and I put her through all kinds of tests. It was gone. All of her knee pain was gone. This whole scenario took me 15 minutes. And it's simply because we just keep going up the chain until you figure out what may be affecting the knee. If I think it's the knee and I don't give myself any other possibilities, I'm not getting to get what it needed, because it obviously didn't. It was 2 years. Keep going. Keep looking. if it's not getting better within a normal time frame, look up the chain, check the back, check the neck, because it shouldn't be lasting as long as that. Pain can, if you get an injury, 4 to 6 weeks, 4 to 8 weeks, it should continually get better. If it's not, there's another component that we're probably missing. Another story is a football player. He came in the training room and he's like, I got knee pain. I'm like, okay, let's check it out. So I started moving his knee and it looked all right, felt all right. It was a little sore, a little vague though. And I said, okay, what happened? He goes, I run into my knee, gave out and collapsed. I'm like, okay, interesting. So we looked at the quadriceps. No quad contraction on that side. I'm like, okay, so something happened here. Everything in the knee was vague. So I'm like, if it's not glaring at me, I need to keep looking. So I checked his back. His back looked pretty good, but I had him do some exercises just in case if we could open it up and see if there's any neural involvement there. No change. Still no quad contraction. I'm like, this is really weird. What exactly happened? I was running down the field, and he was playing football, and somebody came over and hit me in the head. The defensive back hit the receiver in the head, and my knee buckled. I'm like, okay, lay down. I get him on the table. I grab his neck. I do a little manual distraction, maybe a minute's worth just to open it up and see. And I distract it, and I say, now try your quad now, and full quad contraction. I'm like, great. This is when I gave him a couple neck exercises, keep his neck loose, never had another problem. So the story was really significant, and it changed how I do everything, and I'm always looking. So if you have any problem in your foot, your ankle, your knee, your hip, always keep looking up if it's not getting better, because we have chronic conditions down there all the time, and they don't get better, and a large part of the reason is because nobody's going up the chain to see what may be involved, and a lot of times it's the back, a lot of times it's the neck. The same thing for carpal tunnel, elbow, shoulder pain. Always keep going and looking to see what else may be affecting it, because it's usually there. So I hope that helps.